Hello, I am Sheila Marie de la Cruz from BSN 1B, and for today's video, I'm going to demonstrate the assessment of skin, hair, and nails. For the demonstration, the materials I'm going to use are the metric ruler or the centimeter ruler, a pen, client health record, gloves, and if pen light is available, use it, same with the magnifying glass. Before the assessment, I already checked for the doctor's order, and I also reviewed my patient's health record. Then, provide privacy to the client by closing the doors and the curtains. Then, perform hand hygiene. Hey ma'am, I am nurse Sheila de la Cruz and I will be your student nursing assistant for today. So, I'm going to assess your skin, hair, and nails. But before I start, can you state your name, please?
Sharon Villa.
What about your birthday?
June 20, 2003.
How do you want me to call you?
Kyla.
Okay. So, Kyla, I'm going to assess your skin, hair, and nails. Is that okay with you?
Yes, ma'am.
Okay, so I will now proceed to the assessment. So I'm going to ask a few questions. Do you experience or are you currently experiencing any skin problems like dryness or swelling?
Yes.
What is it?
Dryness.
Okay. What about lesions? Do you have any lesions?
No, I don't have.
Are you using any skin products like lotions, etc.? Do you have any skin allergy for food or medications?
Yes, I have skin allergy when I eat shrimp.
Do you have any family member who had skin problems? Okay, ma'am, so now I will proceed to your physical assessment. So I want you to put aside your bag and also remove your jewelries. So for the physical assessment, can I see both of your hands so that I can assess your skin? Okay, so we will put it here. Okay, come on. So my patient's skin color is light brown and her skin color is evenly distributed to her body. So I do not see any lesions or bruises present in my patient's body. Then from my distance, I also do not smell any odor coming from my patient. So now I'm going to assess my patient's skin texture, thickness, moisture, mobility and turgor. Also, I'm going to detect for edema. To assess the skin texture, I'm going to use the palmar surface of my hands or the palmar surface of my 3 middle fingers. So my patient's skin texture is slightly dry but slightly smooth also. For assessing the skin thickness, if lesions are present, look for the lesion and measure its size, its thickness, its tenderness, and mobility. But since there is no lesion present in my patient's body, there is no need to examine. So now I'm going to assess my patient's skin moisture. I will check the underskin folds and even on the unexposed areas. For assessing the temperature of my patient, I will now be using the dorsal surface of my hands. So, ma'am, again, your hands. Going to assess your temperature. Also, okay. So now, I'm going to assess the skin turgor and mobility of my patient. I will do it on my patient's hands, also on her clavicle. If it is possible, instruct the patient to lie down on a bed so that you can assess the skin turgor and mobility of her clavicle. For assessing the skin turgor and mobility, pinch gently on skin, then observe how it goes back to the original position of the skin. I'm going to assess your skin mobility and turgor, so allow me to pinch on your clavicle on your hands. So first on your hands. Please lean backward. Okay. And then now, I'm going to palpate the skin to detect any edema, especially on the feet and the legs. For detecting edema, press the skin using your thumb. Also on your legs and on your feet. So there is no edema present in my patient's body. So ma'am, I will now assess your nails. I'm going to assess for the cleanliness, the grooming, the capillary refill, and the shape of your nail and its texture. So ma'am, now I'm going to assess your nails. So I'm going to inspect for cleanliness and grooming, also the shape of your nails, and I'm going to palpate it for the texture and for the capillary refill of your nails. So your hands. To test for capillary refill of the nail, press or put pressure on the nail bed, then observe the nail for the color change. So normally, the pink color will go back less than 2 seconds. So now, as you can see, I'm wearing my gloves. So I'm going to assess my patient's hair and scalp. So I'm wearing my gloves for protection. So inspect the hair and scalp for general color and condition. Inspect and palpate the hair and scalp for dryness, oiliness, length, if there are any lesions, parasites, and for cleanliness of the hair and scalp. Use a pen light for a better view of the hair and scalp, but since I don't have pen light, there is no need to use, or I will not be using a pen light. So I'm going to inspect my patient's hair and scalp. If magnifying glass is also present, you can also use the magnifying glass for a better view of the hair and scalp. So I don't see any lesions, and my patient's hair or scalp do not have parasites. Then inspect the amount of distribution of the scalp, body, axilla, and pubic hair. Look for unusual growth of hair elsewhere on the body. So now I'm going to remove my gloves. Now, evaluate the normal and abnormal findings. Discuss all your findings together with the patient. Report any abnormalities or any abnormal findings to the doctor. Then say thank you to the patient for her cooperation and time. Thank you, Ms. Shaira. Thank you for your cooperation and time for this assessment. Also, document the data, especially the subjective and objective data. And lastly, perform hand hygiene. That's it.